We wish to extend a warm welcome to everyone. Happy that you all were able to join us for this afternoon. My name is Jonathan Jones, and I'm your host and moderator for this afternoon. It's the Healthcare Support Association of America, in close cooperation with Engage Global. We talk about various health topics each week, and our goal here is to simply pass on public information and to allow you to be more aware of things that could have an impact on our health, both from a positive point of view and from a negative point of view. So we don't mind sharing with you some of the cold hard negative facts, but our goal is to give you some options as to things that you can add to your diet that could be of benefit to you in making decisions about your health and well-being. The information that we're providing is purely for educational and entertainment purposes only. Nothing that we're saying here today is intended to be construed as a substitute for a visit to your primary healthcare physician. We strongly recommend that you seek the medical advice, the competent medical advice of professionals that you trust, and do not just take anything that we're telling you today as a decision, as the final decision for anything you do with regard to your health. Speak to your doctor. We're going to have a very special guest with us today as well. So we'll get a chance to hear from and interview Dr. Prasad, but we'll get to Dr. Prasad in just a minute. Last week, we told you that we were going to talk a lot about heart disease. So just to kind of lay the foundation of the issue with heart disease and why we need to have a conversation about this. Actually, I don't think anybody really needs to be convinced that we need to have a conversation about it. I think everybody knows that heart disease is the #1 killer in this country and it is. It's just, it's a horrible, horrible fact. There's a study that's been being done in Framingham, Massachusetts for more than 100 years, and still heart disease. They've been studying heart disease, and it's still the #1 cause of death. And just today, 20 minutes ago, I took this screenshot from the CDC's website, and you see the first bullet point, leading cause of death for men and for women, and people of most racial and ethnic groups in the United States. One person dies every 36 seconds. That's sobering. About 659,000 people in the United States die from heart disease each year. That's 1 in every 4 deaths. 25% of all deaths are associated with heart disease. That is sobering. What about coronary artery disease? Very closely related, CAD. Notice that 18.2 million adults aged 20 and older have coronary artery disease. About 2 in 10 deaths from CAD happen in adults less than 65 years old. And right now, the first bullet point, killing 360,900 people in 2019. So it is the most common type of heart disease. And then a couple statistics on heart attacks. 805,000 people each year have a heart attack. 605,000 their first. 200,000 happen to people who have already had a heart attack, and 1 in 5 heart attacks is silent. And the part of the sentence that's cut off there that says the damage is done, even if a person is not aware of it, there has been some damage done to the heart. Generally speaking, your doctor will tell you to change your diet, improve your diet, live a healthy lifestyle. And that's typically the solution that's given. And often they'll put a person on cholesterol lowering drugs, and we'll pull some of that out of Dr. Prasad a little bit later on. But is that really enough? It's kind of scary when you think about being told to eat more fruits and vegetables, and that really truly translates into potentially consuming more pesticides and weed killer or glyphosate, because this is not an uncommon picture. This is the way that most food is produced here in this country, with heavy pesticides and weed killer being sprayed on the field. So you have to really work hard to try to find something that isn't laden with pesticides. The risk factors for coronary artery disease, well, the list is extensive, but this is just a short list of things that could put a person at risk for it. The one that scares most of us is being overweight, because they say now that even a small amount of belly fat, especially in men, a small amount of belly fat uh, gives a 40% higher chance of having some sort of coronary event. That's sobering, very sobering. Now we get to the moment that you're all really here for. That's all the bad news. But now the good news. The good news is that we've been able to convince Dr. Kedar Prasad to join us for this afternoon. And Dr. Prasad has a list of accolades, as you can see: renowned scientist and researcher, member of the British Royal Academy of Medicine, first radiation biologist PhD in the world, more than 250 published articles. One of his most recent articles just a couple of years ago was an article that outlined the benefits of antioxidants and micronutrients when it comes to the disease, the pandemic, and COVID-19. So he was able to write an article, a published paper, that showed the connection between those two. He's an author of 31 books and a former member of the Nobel Peace Prize nominating committee. So we're pleased to introduce and welcome to our meeting once again, Dr. Kedar Prasad. So Dr. Prasad, thank you very much for joining us once again.
Thank you, Jonathan, for inviting me to participate in this important issue.
We're always happy to have you. And it's hard to have a conversation about a serious health challenge and not include you in some way in our conversation. It's very difficult not to do that. And one of the things I wanted to try to pry out of you is going to be a little bit of information. I'm just going to now start to kind of probe your memory and see if you can give us a little bit of the backstory behind this book. I've told this audience and many others about your authoring this book, Fight Heart Disease with Vitamins and Antioxidants. So can you give us a little bit of the backstory behind this?
Yeah, I think the reason I initiated to writing this book is that you see the most of the press and clinical study, and you are informed that the antioxidant is not good for you. For example, most of the clinical study which has been done with antioxidant in heart, and one is the HOPE trial, they use only one vitamin, like vitamin, in this case was vitamin E. And it was very extensive study. And in this scenario, they found no significant effect at all on heart disease. And under some subgroup of heart disease, it may increase the risk of the further advancement of the disease.
But that would not have been good news for the natural nutrition industry.
And the reason that's not a good news, and that was very much publicized and people got in mind, but I felt that it is well known that if single antioxidant, if you give to a person who has already, for example, heart disease risk factor, for example, and they have a high level of oxidative stress. In other words, the body is producing a lot of free radicals and also has a high level of inflammation. And that condition, if you just give one antioxidant, whether vitamin E or beta carotene or any, they will get oxidized and act as a free radical rather than as an antioxidant.
Wow.
And so you almost would have predicted these results. And, yeah, this is very important to remember. For example,
I didn't know that, Dr. Prasad. That's interesting.
And that's the reason it fails, or it sometimes have adverse effect. Another good example would be that well known, this is not related to heart disease, but it's related to the fallacy of using antioxidant in human diseases. For example, you may remember, Jonathan, that a beta carotene trial among smokers who has a high risk of developing lung cancer. So the criteria was the that does beta carotene will reduce it. But again, same issue is there, because high-risk population have a high level of oxidative stress, high level of inflammation, and beta carotene will be oxidized and will act as a free radicals or pro-oxidant rather than as an antioxidant. And therefore, you could predict that it will increase the risk of lung cancer. And indeed, in that trial, we have spent millions of dollars in trial and from a very prestigious university. And you'd have predicted, and indeed, there was a 17% increase in a lung cancer among those who were taking a beta carotene compared to placebo. So,
My
so many
goodness.
diseases, they have used it only single antioxidant, but there is no data to show that if you use a multiple vitamin, that it happens same thing. For example, there was a clinical study done with a commercial product of antioxidant, which is not as good as ours, multiple antioxidant. And they found in a high-risk population that incidence of cancer was reduced by 10%, multiple vitamin. And so, and even the cases, for example, the value of a multiple antioxidant, even it was demonstrated, these are clinical studies to show that this is also we found in a heart disease. But I've been giving you an example of that when you see any study with a single antioxidant, just ignore it. And even they tried in a clinical study, it was double-blind placebo trial in AIDS cases, AIDS patient. And as you know, that they will require later on antiviral therapy. So before they have antiviral therapy, question was, if you give them right in the beginning antioxidant, can it delay the need for antiviral therapy? And indeed, when they gave a not very good antioxidant preparation, but some multiple, and they found so that it was delayed several years before you require the antiviral therapy.
Antiretroviral therapy.
And so these are some example of clinical study that shows that individual antioxidant is no good. And that necessitated for me that I should address that issue in my book. And that's the reason I wrote The Heart. And we have published a paper as well, as you know.
That's
and
fascinating.
I'm in great detail about the property of the antioxidant and why single antioxidant should not be used for any purpose for your health. And so, and then you will see that some of these things that I predicted in this book came to be true in a clinical study that we will discuss, Jonathan, that we did in a firefighter in Denver.
Yeah, I want to ask you about that in just a moment, but that's an amazing backdrop, and I think none of us really knew that story, and I certainly was not aware that a single antioxidant could actually work against you, as opposed to having a combination of antioxidants. So to the idea that one antioxidant could become a free radical in itself is just mind-boggling to me.
Exactly, because once the antioxidant donate the electron for other molecule that needs it, it becomes oxidized.
It's oxidized.
It becomes itself.
Yeah.
But if you have a multiple antioxidant, then they help each other, and therefore they don't become one.
So this is the reason why glutathione is so important.
Yeah.
This is the reason why glutathione, your body's natural antioxidant, is so important. It's critical. And in your formula, Micro Daily, you have not only multiple antioxidants, but you also have the precursors to glutathione, which now the master antioxidant is elevated right along with this additional contribution of additional antioxidants.
Yeah, I think, like you said, glutathione is one of the most important antioxidants, and it's present in extremely highest level in the body than any in the cell, than any in heart disease or any other disease. it is extremely important to have a very good level of glutathione. And that's why in this, generally you will see that, for example, alpha lipoic acid. If you just give alpha lipoic acid in a multiple vitamin preparation, it will increase. Alpha lipoic acid has many other functions, but one of the important functions is that it increases the glutathione level by increasing their formation synthesis, the enzyme, glutathione peroxidase. But we also added N-acetylcysteine, which is a synthetic compound. And the reason is because N-acetylcysteine is very quickly absorbed in the body. On the other hand, if you, and then N-acetyl part is chopped up when it goes to bloodstream, and cysteine is used to make a new glutathione. So there are two different ways. One is the enzymes way, one you provide the precursor of glutathione enough so that your glutathione level is maximum in your body all the time.
That's brilliant. That is just absolutely brilliant. So I've been told now that, and I don't know how true this is, but for the most part, N-acetylcysteine has about a 12-hour half-life. So for about 12 hours, it stays nice and elevated. And that's the reason why, and I think you were the one that may have told me this.
Yeah.
That's why you recommend 2 doses. So if a person takes it at 8 o'clock in the morning, their second dose should be at 8 o'clock in the evening.
Yeah, I mean, roughly 8, 12 hours, could be 10 hours, but roughly twice a day in the evening. Doesn't have to be exactly plus or minus an hour. And not only N-acetylcysteine or alpha lipoic acid, but whole micronutrient, they disappear from your blood at a different rate, but by evening, at least 50% is gone.
Gotcha.
Whatever micronutrient.
Gotcha.
And so then another 50% will go in the morning. So your body sees a lot of fluctuation if you take only once in the morning, very high level of fluctuation up and down all the time in your body. And when that happens, the gene expression to cope with this variation, they make a lot of alteration. And if you are doing that all the time, one time they can do mistake and can cause mutation that could be harmful. Right. So in order to avoid that, if you take twice a day, then relatively it is a steady level of all micronutrients that you are taking.
Very good. Very good. Now that makes perfect sense. That's good to hear it broken down that way, so we can all pass that on to any of our clients, the benefits of that. We have some folks that take it 3 times a day. So so that's good. So Dr. Prasad, now let's talk.
But I mean, that's okay if somebody decides to do that. But these are the things that micro daily that you saw the picture of, that we have collaborated with the Department of Defense laboratory as well as the NASA to test its efficacy in not only in the human, but also in the animal model. Because some study like radiation protection, you cannot use human, so we have to use in the animal model, and in all those study has been extremely good.
Yes. Well, tell us a little bit about this one here with the U.S. Navy, because it says here that the functional use is for pulmonary and heart health. So we're anxious to hear how this study, the U.S. Navy and the one with the fire department here, and the U.S. Army, there was some evidence that this micronutrient was beneficial in heart health. Can you tell us a little bit about that?
I think heart health, as you emphasize it is very important in addition to what I will say, taking micronutrient like micro daily, but also very important to have a diet as best as you can. And some of the examples you put in your slide, fresh fruits and vegetables, and maintain the weight is very important. Don't smoke, and also have a relaxed lifestyle. Go for vacation.
Low stress.
Visit your friend, relatives. Is as important as macronutrient. And so, but the question is, human behavior are difficult to change.
Right.
No matter how you say about the diet, it has very little impact because nobody follows that.
That's right.
And so, and this is not only true for heart disease, but for other diseases like cancer. Same
Right.
thing. Heart Association or American Cancer Society, they are telling people modify the diet and lifestyle. And Jonathan, some of you mentioned it, but nobody does it. So the
No.
incidence of heart disease and cancer is increasing instead of decreasing.
That's right.
So then what you do then I said, okay, try to do as best as you can, and then have a micronutrient,
Mm-hmm.
such as a micro daily. And the study that today is heart disease. So I will give you one example that we did a clinical study.
Okay, good.
And again, like any other disease, increase production of free radicals as you grow older, or if you're obese. Obese people have much higher level, even younger people. If you're obese, you have very high level of oxidative damage in your body, very high level of inflammation. So slowly, these things affect your heart disease, muscles, blood vessels, everything, and you have at very high risk of developing heart disease.
That's right. They're
And
right. And Dr. Prasad, before you go on, there was a study recently that we were discussing here on this channel on Sundays that says that not exercising is worse than being a diabetic smoker. So not exercising is extremely unhealthy. So
yeah, exercise is very important.
yeah, walking at least 7,000 steps a
Walking,
day, they say.
20 minutes, 30 minutes of walking, anything you walk, not only is good for your heart, but also diabetes, because
Yes,
sometimes, these are very closely linked.
right.
And so that's the only way you can do it. You can do some, if you go to gym, any way you can do exercise. You can have a treadmill in your house if you don't want to go any place. I mean, so you have to do it. Walking,
Get
I walk
moving.
every day.
That's it.
And I used to play a lot of tennis, but now I can't. I'm 86-year-old. In January, I will be 87. So I can't have those kind. But in my young age, I played a lot of sports, and still I walk a lot.
Right. Walking is important. So go ahead. Tell
Walking
us
is very
about, I'm sorry
important.
to interrupt you, but tell us about the study.
Tell your exercise or the study?
Yeah, the study on heart health. I interrupted you. I
Yeah, heart.
apologize.
Yeah. And this study was done in Denver, Colorado, when I was professor at the University of Colorado Medical School. And it was the study was done in collaboration with Dr. Jeffrey Boone, and he's himself a cardiologist, and he's also a main cardiologist for a NFL Denver Bronco, and so he's highly respected in a NFL league for his advice and what he recommends people to do it.
Uh-huh.
And so we did a study in Denver, but not in a football player, but he gives a lot of advice of micronutrient or retired NFL Bronco player. But what we did was among firefighter of Denver. And firefighter, as you know, is very high risk of developing heart disease.
Yep.
And this age group was like around 35 to 45 years of age. And they were not on any medication of like a statin or anything like that. And so he just gave a micro daily. At that time, we used to call by different name, but there was micro daily formulation.
Uh-huh.
And what he measured there was the lipid profiles, like LDL, HDL, total cholesterol. Nowadays, there is a very small molecular weight cholesterol. And so he measured all this. In addition to that, he also measured the thickness of the carotid artery. Carotid artery that supplies blood to your brain.
Yes.
And what happens as you grow older, they become thickened, wall of the carotid artery, and then blood cannot go through your brain as much as you want to. And therefore, it can lead to a dementia, it can lead to stroke and all kind of problems. So it is very important to keep the carotid artery open as long as you can. And as a function of aging, you can't avoid it, they get thickened because of the damage by inflammation and free radicals. And so he measured this thickness. And then he had, previously he has done a lot of with a statin, just a statin alone.
Yeah, like Lipitor, Crestor, things like that.
Yeah, like that, simvastatin. And so many kind of statin drugs. So in the same group of people, he had done a statin drug alone in the before he started the experiment. And he measured the same kind of things that he is going to measure with micronutrient. And the study was for 1 year, and the total number of participants, or firefighter in this case, was 70. So it was a good, reasonable sample size. And he measured at 6 months, just micro daily alone, and 1 year. What he found was that after 1 year, that the lipid profile, like LDL was low, HDL was high, total cholesterol was low, and it was as good as any other statin drug can produce.
Wow.
Improvement in lipid profile. So he started calling that this is a micro daily is a poor man's Lipitor because it is cheap and because it did the same thing that Lipitor does.
But with no side effects.
But one thing that the micro daily did that none of the statin drug can do it ever is that it blocks the rise of any thickness of the coronary artery. This is very important because I never predicted that micro daily can have an impact on the modification of your tissue. In other words, so the wall was not thickened, did not rise it, but with a statin, it kept rising like it is supposed to as you grow older.
Right.
And so, but it microdaily totally blocked any rise in the thickness of the coronary artery. So that was very, very important finding.
That's huge. That's huge. And very, very good to know. So that's pretty impressive.
So it is very impressive in terms of preventing the disease or progression of the disease, as well as so if you combine this with a good diet as best as you can, good lifestyle as best as you can, you are ahead.
Yep, I would agree with that. And that's the reason why we place so much emphasis on micro daily, because it just has all kinds of additional benefits. In my research, Dr. Prasad, I just want to just add a couple of things here. I found in the physician's desk reference that they had an article that mentioned that glutathione deficient states, and on the list of glutathione deficient states, stroke was listed right in there as a precursor to having a stroke. And then there was another article I found in USA Today where they did a blood test. They developed a blood test that could warn of a heart attack. And this was done at the Gutenberg University in Mainz, Germany. They said that they showed for the first time that low levels of glutathione could suggest a coming heart attack. So I would say it's a very good thing that microdaily has the ability to raise glutathione levels.
Yeah, and probably they just measured glutathione. Probably if they would have measured at that time some other antioxidant, they would have found the deficiency too. But not all have to be deficient. Even one deficiency can increase the risk of many diseases. And so, since glutathione is one of the most powerful one, I'm not surprised that you will see glutathione deficiency can lead to dementia, like you listed all the disease, and include Alzheimer, and dementia can have without Alzheimer, and so it is very, very important to have a high level of glutathione all the time in your body.
Very, very important to hear. Very significant. Well, thank you very much for sharing that with us. And just to emphasize the information that's provided here is for educational purposes only. So we encourage you to take this information into consideration. This is for our audience. Take this information into consideration when making decisions about your health and well-being, but we strongly recommend that you seek the competent medical advice of
And also
professionals that
that
you
there is
trust.
no, Jonathan, also there is no data that suppose if you are already you have a heart issue and you are in medications recommended by your cardiologist or primary care doctor, these micro daily ingredient that we have there, micronutrient, don't interact adversely. In other words,
Ah,
so you don't have to be concerned that, well, I'm taking, vitamin, how it will impact the medication that I'm already taking, any kind of, whether it is heart or diabetes or any
uh-huh.
medication.
That's
There is
good to know.
no interaction in a harmful manner. As a matter of fact, it can improve because some of the medication could have some long-term side toxic effect accumulation, and this can prevent those kind of issues. And so at least it has no adverse effect. If anything, it could have beneficial effect in
That's
terms
good.
of if
That's
you are
good. And
on a.
I hope everybody heard that and heard that clearly. This is the formulator of Micro Daily, making it very clear that it's been proven already that Micro Daily does not contraindicate with any drugs or medication that the doctor has been prescribing. So that's already been proven, because that had to be proven to the United States government before they would even accept it and provide it for the military. No contraindications. So that's good to know.
Yeah.
And we're highly encouraging everyone to make the adjustment and go to the methylated formula. The methylated formula increases absorption tremendously. So this says the MTHFR, but now the bottle says the methylated formula. So we highly recommend that this is the one that each person considers going to. And part of the reason for that, we had a nice discussion with Dr. Prasad about this about a month ago now, is it has to do with the absorption of B12 and B9. So Dr. Prasad reformulated to make sure that we have the most absorbable B12 and the most absorbable B9 in this formula right here. And before you think that that's not that important, your entire central nervous system is connected to your ability to absorb B12 and B9 and many other serious components in the body.
Yeah, I think, not only that it is better absorbed, but it is also retained in your body for longer period of time.
That's good
And
to know.
so it is not as eliminated as quickly as, for example, folic acid, if you just take folic acid. And so we gave a methylated form of folic acid, and because that's the form body uses it, and not in a folic acid. Folic has to be converted to methylated form in your body by an enzyme, and MTHFR enzyme. But somebody has mutation, then they can't convert efficiently to a methylated form. So in order to avoid those kind of things, even though almost all previous clinical study with folic acid has been used folic acid, and because they were not concerned, it was a cheap, some drug company gave them. So,
Yeah.
but later on, we found that methylated form is much better of folic acid because, like you said, Jonathan, it is absorbed quickly from the intestine, and also it is retained in your body for a longer period of time than, say, than the folic acid is poorly absorbed. It has to be converted to methylated form. So why to wait for that? Because some people may have mutation on this MTHFR, and then and vitamin B12 like cyanocobalamin. It was a concern some people about the cyanide issue. Cyanide is a gas. The word cyanide is a scary word, but
Yeah.
people forget that if you take a 1 gram of almond, for example, you will get a 200 microgram of a cyanide. Every day we consume it has a lot of cyanide in it. That's natural component,
It's
but
natural.
they evaporate when you get to your body, and so it is non-toxic. But our preparation has only 2 micrograms.
Right.
But even though that slight concern of people, we said, okay, we will put methylated form of cobalamin or vitamin B12, and because that is the form body uses it, so don't worry about this.
Well, we're happy.
Yeah.
We are happy to have that methylated formula available to us.
Definitely.
So for those who are here for the first time, just get back with the person who invited you to this discussion, and they will help you set up a preferred customer account or to become a health advocate. As a health advocate, you could get referral commissions and income from telling other people about what could potentially benefit them and their health. And this is just a short snapshot of the formulas that are available. Dr. Prasad has also produced a hydro formula. It's a little powder packet that you just put it in 12 to 16 ounces of water and drink it down. Tastes delicious. Children even love it. And Dr. Prasad has stepped out and produced even a gummy, a children's gummy that the kids love it. And I just found this out. I didn't know this, Dr. Prasad. You put the methylated bees in the gummy formula also. So that's a wonderful thing to know. So the gummies has the better form, the methylated form of the B vitamins in it as well. So that's that kind of gets it in a nutshell there, Dr. Prasad. I think you've given us quite an amazing amount of information that I think will help anybody who's having any kind of heart issues or anybody that they care about with some heart issues. You've given us all food for thought and plenty of reasons as to why everybody should consider making sure that they have micro daily as part of their diet, especially if they have any heart concerns. So can we take a couple minutes now, Dr. Prasad, and see if there's if any have any questions about what we've discussed? And I want to just remind everybody, Dr. Prasad is not a medical doctor, so we need to avoid asking Dr. Prasad medical questions. He's a scientist. So the information he's going to provide us with is scientific information and scientific analysis. So you go back to your doctor when it comes to that. But if you have a question about something he said today, now would be the time. And if you also have a story that you'd like to share with us, I know Dr. Prasad would love to hear any positive results you've had with the product. So we'll do that. Okay, so the first hand was up was Lula Jester. So let's see if we can't get Lula to go ahead and unmute, and we'll add her to the spotlight.
Okay, so Dr. Prasad, that was a very interesting presentation. And I really got interested when you were talking about the person from your study. You had no idea how it would help with the cholesterol numbers.
Yeah.
Was that the original formula? And if it was, how many do you know if he was taken to help him bring those numbers down?
What did you say?
How many of the capsules did this person have to take to bring those numbers?
It was 2 capsules in the morning and 2 in the evening.
Thank you.
Very good. Good question, Lula. Thank you very much. But like you said, that was the original formula, and just 2 capsules twice a day, and it worked phenomenally. It's even better now with the new formula. So very good. Thank you. Okay.
Hi, good afternoon.
Yvonne
Can you
has
hear
a
me?
question. Who's that?
I got a question.
Your name, please?
Can you hear me?
What's your name,
please? Can you hear me?
Yeah, I can hear you. I'm trying to get your name.
Okay, Hyacinth.
Okay, Hyacinth. There we go. So I see you now, Hyacinth. Go ahead.
Hi, Denise had recommended me to the vitamin. My question is, do I need to take vitamin E, vitamin D, vitamin C, or any other vitamin with the micro?
No, you don't have. I mean, do you need to take any extra? We have all those vitamin in micro daily.
Okay, that was my question. And what about the vitamin?
No extra needed.
Yeah, I had some of the she gave me some sample of the vitamin. So it's 2 different vitamin. Which one do you recommend for me?
Which one is you got it?
The green one.
Do you remember what is the green one?
She's
the
talking
green one
about
is the methylated form.
She's talking about the original formula, but the purple one is the methylated. So that's the one that we would
Methylated
recommend.
form.
The purple one?
Yes.
Yeah.
Okay. Well, thank you very much. It was very, very interesting. I learned a lot, and I definitely want the micro with the
Thank
other
you.
vitamin.
Excellent. Thank you so much, Hyacinth, for your question.
Thank you. You're welcome.
Okay, we have Yvonne has her hand up also. She's got a question for us.
Hi, Jonathan and Dr. Prasad. Thank you so much. That information was so awesome. And I had concerns about my heart because I noticed when I got up in the mornings, I was extremely dizzy. And I went to see a Dr. Gandhi. He's a cardiologist. And he would say, when I get up in the mornings, I should drink some water. And that has helped tremendously. So now that I know that I can do the micro daily, and that will help with because when I did my blood tests, it showed that I had high cholesterol, my LDL or whatever it is, all those different ones that were showing very high. And so now I know that I can do the methylated micro daily to help me where that is concerned. So that was just awesome. And because he had prescribed Lipitor and I did not take it. So this is just awesome.
I think in the meanwhile, I would say that if doctor has recommended, at least you should start with a 10 milligram of Lipitor or whatever statin drug is, because that is very harmless, and it will reduce your cholesterol because vitamin effect is slowly.
Okay.
And so I would say that you take Lipitor in combination with this, and if cholesterol goes down very much, then you can ask your cardiologist. Even though, for example, my wife takes a 10 milligram, my son, who is a doctor himself, take 10 milligram, and because it is very important to keep the cholesterol lower, and since you have already high, if you did have a high, then I would have taken that you take a micro daily alone, but you have already high, and effect of vitamin is a little slower than, say, for example, statin drug or Lipitor. And therefore, my suggestion would be that you continue to take because with Lipitor, within a week, you will have cholesterol down. But to see the good effects of vitamin, it might take 6 months. So during that transition period, I think it would be a good idea to have a statin because it is very harmless. Harmless in the sense that it has no side effect on that particular dose. I'm talking about 10 to 20 milligrams.
10 to 20 milligrams.
Yeah, but sometimes doctor recommends 40 milligrams. That's too high. But
okay, 10 milligrams.
10 to 12 milligram, he keeps, my son is taking, I just say my wife is taking, and I take it. And so it has no downside. And therefore, I think I would recommend to take both.
Very good.
Thanks, Dr. Prasad. Thanks, Jonathan.
Yep. Thank you very much, Yvonne, for your question. Sonia Dizon has a question also. Go ahead, Sonia.
First I have to tell you, since last week you mentioned about MTFHR. And before that, really my energy level is a little bit down. Although I have been religiously taking the micro daily all these months. So when you said that, I said, maybe I should order the MTFHR, and it came yesterday. So I took it yesterday. I think 3. I took 3 and then 3 in the evening. And then today I really could tell the energy level. I just have a lot of energy today as opposed to the previous day.
Oh,
so why is that, Dr. Prasad? Because I have taken EMF, and I have taken the hydro, and I have taken the the green bottle. So what did it do differently in my body?
Well, I mean, you are taking methylated form, right?
Yep.
Yeah, now.
Yeah, now taking. So I mean, sometimes it varies with one individual to individual so much, but are you not too, maybe you are not too much exposed to electromagnetic radiation, EMF radiation. And so you don't need a micro daily EMF. And for you, I think micro daily methylated form is sufficient. And it has all the ingredient of the original formula, except those two, like Jonathan mentioned. So I'm glad that you are having more energy. This is one of the consistent observation by many, many people that they feel more energy.
Yeah, yeah. And
And
so
not
now
only
my
energy,
question,
that you will see that, you know, overall your health might be feel much better.
okay. Now a question from my sister-in-law, who is also a who takes micro daily, but she has heart problem, and she has a was that the prolapse, valve prolapse?
Micro valve prolapse.
Yeah, yeah, and
Mitral valve prolapse.
yeah. Should I recommend the MTF-HR to her?
The
Well,
methylated.
in case of so she must be in the care of the cardiologist, and if he's taking any medication, I think that I would suggest that she talks to cardiologist. But I think I see no other reasons why not she will take the micro daily. Cardiologist will say, yeah, go ahead and take it in combination with the drug that he is recommending, because it is not a substitute for the medication that he's getting it. And so I think it will do a lot of good for her health. And so I would say, yes, I would recommend it. And,
yeah, because instead of taking the green bottle or micro daily form,
I mean,
original.
Generally what cardiologists will say, yeah, you go ahead and take it, it will not hurt you, you know. But I think it has a lot of benefit as well. But they are not trained. They are not trained in nutrition. So you can imagine.
Thank you so
Very
much.
good. Thank you so much, Sonia. Very good question, Sonia. Thank you. Okay, so that's kind of interesting, and it goes right back to what you said before, Dr. Prasad, that you know, here's she just notices the difference. She was taking the original formula, and her energy level wasn't so great. She switched to the methylated formula, and her energy level, she saw an increase in her energy levels. So that's pretty good.
That's very good, yeah.
And I'm going to talk to Sonia too, just to find out if she was not taking the right dose of the of maybe one of the other ones. But I noticed that also, by the way, my energy levels went up when I switched to the MTHFR formula. Okay, let's see here. Linda Salomon has a question. Camera's off, so I can't add you to the spotlight. But go ahead, Linda.
Yes, I also, have a question. You mentioned a while ago, or you showed it to your to us that do I have to show my video? Because
No, you don't have to. No, you're okay.
Okay. You said that it's good for heart and pulmonary. I don't have problems with heart because like I'm doing a diet that really prevents me from having heart problems or high blood pressure. And but my pulmonary problem was that I'm having a sometimes feeling restrictive breathing, and I would like to know how long shall I take the micro daily to feel the effect,
Well, I mean,
and also that I would like to know what else that I would like to ask. You mentioned that we don't need any more extra vitamins to go along with it. Of course, I'm still taking magnesium, extra magnesium, and sometimes, like vitamin C. But I will try to do that tomorrow to remove all the extra vitamins and see if that will make a difference.
Yeah, extra vitamin, only thing that I recommend extra is the vitamin D3, because many people, even younger people these days, have shown a deficiency in vitamin D3, even though we have in our micro daily 800 international unit of vitamin D3. And so if somebody wants to take another 2000 vitamin D3, that will be okay, extra. But taking extra vitamin C, we have more than enough vitamin C in our preparation. Magnesiums, if you are a deficiency in magnesiums and your doctor recommends it, then only I will say that take magnesium. But again, I don't know what form of magnesium you are taking.
Citrate.
What form, do you remember?
Yes.
Is it magnesium oxide, magnesium
No,
citrate?
citrate.
Yeah.
Citrate.
Yeah, citrate, yeah, or citrate, or yeah, magnesium citrate, then they absorb very nicely. But until you have what they call, if you have a deficiency and a doctor has recommended, then I will say take.
Yeah, but what I want.
But if doctor has not recommended it, then in my opinion, there is no sense. You can take one banana a day or a couple of times a week. That should be good enough. But I think, but other vitamin, you don't take it.
Yeah, but I would like to add, I would like to know how long shall I take the, micro daily? Because, like I told you, I have the restricted, breathing, sometimes, especially in the morning, and I would like to see, how I can, take care of that.
I always say that, first, if you have some real problem, you should see the primary care doctor. But otherwise, for anything for your health, I recommend to take for 90 days. And if you don't see any improvement on your health, don't feel good, or as you feel as bad as today, then don't take it.
Thank you very
90
much.
days trial, that's the time. Most of the time people will say, oh, I feel great after 1 month, but I gave a 90 days or 3 months to see any benefit for a particular condition, if you have or not.
Thank you so much.
Good. Thank you for your question there. What was your name again? That was Linda. Okay.
Linda Solomon.
Yes, thank you very much for your question, Linda. And Linda, if you would send me an email. Send an email to jonathan@hcstraaa.com. That's for anybody that wants to contact me. If you have another additional questions for Dr. Prasad, also jonathan@hcstraaa.com.
Yeah.
And I'd like to have all your contact information as well. But Dolores Levette has another question, a question that she would like to ask now, or a story she wants to share. Go ahead, Dolores.
I just want to share about my switching over to the methylated.
Yeah.
Once I heard you talk about it, I've been taking Macro Daily, the capsule and the hydro, and I thought I was doing well. I feel okay. But when you was talking about the methylated, I switched over. Okay, I feel much, much better.
Good.
Yeah, much better taking the method. When I first took my first couple of doses, my overall well-being, I just felt better. And as each day goes, better and better.
Yep.
Okay. All right.
I have to agree that that's definitely happening. So thank you, Dolores, for chiming in and sharing that.
Thank you.
iPhone copy link 1. Someone else's hand is up here, but there's no name. So who is that? iPhone copy.
Ruth Lawrence.
Ruth Lawrence. Go ahead, John and Ruth Lawrence. Please go ahead.
Okay. I'm not at home, so that's why I'm using my phone. I didn't want to miss the meeting. But I wanted to ask Dr. Prasad about radiation. My husband and I went to the chiropractor, and she told us that she wanted us to take a few x-rays so she can know where the problem was in our necks and everything, because we was in an accident. And so we told her, okay, because I know you're not supposed to have a lot of radiation. But when I got in there, she had the oldest machine in the world giving us this radiation. It wasn't a new thing. And I looked at my husband, I said, this machine is too old for us to take this radiation. He said, don't cause no problem. Just take the radiation and we'll be done with it. I said, but I don't want to. This machine is really old. It's probably going to pour radiation into our bodies. Anyway, make the long story short, he said, take it. So we took it. But since then, I noticed that we don't keep weight. We can't keep our weight. And I lost about 4 dress sizes.
Wow, you can't afford to lose that.
And John lost a suit size. So everybody say, you guys look like y'all losing. Why y'all losing so much weight? So I'm wondering, is she did, I don't know, about 10 x-rays on me and 10 on him. So I'm wondering, did those x-rays cause maybe the weight loss? And then
maybe the amount of diagnostic radiation you may have received is too small to cause any weight loss. If there is a symptoms, for example, if somebody gets accidentally exposed to high level of radiation, then you will have some symptoms of bone marrow depressions, your blood leukocyte, lymphocyte goes down, and you may have sometimes diarrhea. But if there is no symptoms of radiation sickness, and you have not been exposed to accidentally high doses of radiation, then if it is only a diagnostic radiation, for example, for any area of the body, then that cannot contribute to a weight loss.
Okay.
So weight loss must be either you are not eating very well, or and if it is a rapid loss, then you must consult your doctor, a primary care doctor. But if it is a slow weight loss, then that's good. Maybe you have changed your lifestyle. You eat good diet, less calories, and that's the way I lose weight, just taking less calories. And so maybe you are taking less calories, then you are spending more calories.
Yeah, that's that. Now that is some of it, because I eat oatmeal in the morning with nuts on it and cherries or something like that. And then it lasts me until about 12, sometimes 1 o'clock before I eat.
So weight loss is always good. Yeah. As long as it is not very rapid, like within a week you lost 5 pounds.
Okay, so I don't feel too bad about that.
No.
But the purple bottle is the one that helps with radiation. That's the one that's giving everybody this extra energy too, right?
Yeah, but next time when you go, then you must have before that you take your micro daily. That will protect it. Okay. There has been a lot of data that we have collected in animal model that it is a very powerful radiation protection agents.
Okay, great.
And I have written a paper, other people have written a paper that micronutrient is very good radioprotective agents.
Okay. And then I wanted to give an experience. Thank you so much for that, Dr. Prasad. And my experience is I was born with a heart murmur. I was born in the woods 68 years ago, and a cord was around my neck 3 or 4 times, and my mother couldn't birth me. So they had a midwife. Anyway, it was a trauma. It took me, they said it was somehow many hours. And when I was born, I was blue, couldn't breathe. And so the doctor just spanked to make me breathe, and just pop, 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 pop. Anyway, he finally got me to breathe. But then over time, he said, she's probably going to have heart trouble. He was a country doctor. But then when we went to Detroit, Michigan, they did find out I had heart murmur. And so I shouldn't be spanked. I shouldn't be scared. I shouldn't have children. I shouldn't do any of that. But I did get a couple of spankings, and I do have kids. But in the process, my heart will run away. It will go really, really fast if I don't get enough rest, if I eat too much sugar, if I do get scared, really too tired, it will start just running. I think I'm going to die. Well, I started taking micro daily, and it don't do that now. But I got really sick. I got really tired. I wore myself out. And when I really get down like that, it starts doing it again. So went to the hospital. This about 2 years ago, before Corona. So about 3.5 years ago, I had another incident, and it was beating so fast. And so my cousin came, she said, I'm taking you to the hospital. He was at work already. So when I got to the emergency room, told them they checked me out, kept me in there. They said, okay, she can't go home because of her age, she needs to stay in here. So they kept me, and so I started telling them, writing down everything, what was wrong with me. You know, I had heart murmurs, had this, had that. And then I was told too that I had a micro valve. Another man had told me I had a micro valve that had bent over like this. And before I knew microdaily, I always had a problem with walking. If I walked too fast or walked too much and all of that too, and my heart would just run away. And so they would always say, just walk and build your muscles up. That's what you got to do, baby. You got to build your muscles up. My mom, my dad, everybody trying to make me walk. I told them, I said, if I walk, I'm going to die. I can't do it. But when I went into this doctor's office, he found that my valve had fell over and the blood was just doing this, and it wasn't going out. So that's the reason why he said that I was having those terrible conditions. So I started taking microdaily. To make this long story short, over time I've been taking microdaily about 1.5 years. And so when Jonathan first brought it to us, and I was having a condition for that again. And so I told him, I said, I know I have a microvalve prolapse. So he said, well, we're going to keep you in this hospital and take some tests. So they kept me in there. They took me down there the next day to this big place, you know, where you put you on this machine and everything. And when I told the man, I said, do you see the valve? How I said, trying to rise or it's still flapped over? And the young boy said, ma'am, I don't see no microvalve prolapse. I said, yes. I said, it's bent over like this. I said, you got to see a valve that looked like this. I'm laying back, was telling him what I had seen of myself on the machine before. He said, no, ma'am, I don't see it. I said, you kidding me? You don't see it? That's why I'm in here, because my valve is flopped over and I'm overexhausted. He said, no, ma'am, I don't see it. Then he said, sit up. So he picked me up. He pulled me up for me to see what was going on. He said, you see this? This is your heart, right side. This is the left side. He said, this is a microvalve right here. And it was standing straight up.
That's interesting.
It was standing straight up.
Well,
and I said, are you sure? I said, you don't see nothing flopping over? He said, no. Do you see anything flopped over? I said, no, I don't. He said, well, if you had that problem, ma'am, he said, you are cured because this is your valve and it's standing straight up. I was like, oh my God, thank you. I was so happy.
That is wonderful, wonderful, wonderful. So thank you so much, Ruth, for sharing that story. So I don't know, Dr. Prasad, stranger things have happened, right? So we won't comment so much on that one. We'll just move on.
This is another example of modification of your tissues, you know.
Yes. So here's what we're gonna do. We are past the time that we're supposed to have for this discussion, but I do want to get one more question in if we can. Do you mind, Dr. Prasad?
No, that's fine. One more.
Okay, so Linda Ross, she's been kind of flag waving for quite a while here. So go ahead, Linda, let's get your question.
Very quickly, I just wanted to know 2 quick things. Number one, why does microdaily put me to sleep? But everybody I've recommended it to, and trust me, there've been some friends since I got COVID, and microdaily cured me. There's people in my family, folks that I know that have said, Linda, what is that stuff you said cured you? That they've gotten it, and it actually cured them of COVID-19. Now, I'm letting you know, microdaily, they kept saying, wow, Linda, this gives you amazing energy. Good grief. One person stopped taking it because she said, I couldn't go to sleep. I was taking microdaily, I couldn't go back to sleep. And I'm saying, why is everybody else having this experience? But microdaily puts me to sleep. Literally, you know, I used to have issues with like sleeping sometimes 4 hours a day. Microdaily knocks me out like 8 or 9 hours. And I want to know, why is microdaily putting me to sleep, but it's waking everybody else up? And also too, when I came down with some kind of a virus here recently, According to the doctor, it was a virus. If microdaily cured everything except this one gland that keeps bothering me, been going on a month. It's in my neck. So I'm thinking, I don't know what else I should add to it. That this gland, he said, oh, it's just going to take time. There's some bad viruses out this year, and you got one of them, and you're doing better than everybody else. I'm letting you know. He kept saying it. Listen, the symptoms that you had came and went like, I don't know, in 48 hours. And all you complained about is that gland you're naked, it'll fix itself. So it's been going on for a month. I don't know why it hasn't knocked itself out, but I wanted to know those two things. Why hasn't this gland just fixed itself like COVID real quick, what it did with me? And two, why does not microdaily put me in a coma? I'll let you answer.
Yeah, since you had a COVID-19, there's a lot of people who have survived COVID-19 either with microdaily or without microdaily. Some people have survived. They carry the risk of not you, because we were taking it, but at least some risk exists. And I think eventually it should be okay to get rid of whatever you have right now. But most of the people who have not taken microdaily or have been vaccinated, they carry a lot of residual disease like heart, brain, dementia, and all kind of health problem, even though they survived the COVID-19. And so, for me, I always tell people, that if you have not taken a vaccine, you take microdaily plus vaccine, because if your immune system is very good by virtue of taking a microdaily, and if you take a vaccine, you will produce more robust antibody against virus, and there should not be any residual disease, like people are experiencing, those who survive microdaily. And so some of the residual problem that you are mentioning it, or your friend has, eventually should be resolved. And so, but again, this is individual decision, and whether or not take a vaccine or not. But for me, it is very important issue, and I have taken a booster dose and everything else, and so I never had any problem, or my family follow the same principle. When you go outside, you make sure that you have a
mask on.
What do you call the mask on?
Uh-huh.
These are some preventive strategies that has worked for millions and millions of people, and there is no reason why it cannot work for us.
So she can expect then that in time, whatever this gland issue that she has, that may just take more time to resolve.
It is possible, yes. Yeah.
Mm-hmm.
Oh,
Yeah.
I was wondering because it worked so well on the COVID. It was amazing.
Yeah,
right.
But like I said,
different issue.
Even survivors,
yeah,
even those who survived, few of them without taking any vaccine or microdaily, they carry a lot of. You are lucky that you have only one. They carry a lot of
that
different
just came
disease.
recently, doctor. That came from some of this is just some regular virus the doctor said I had that's been really bad recently. And he said that it's not COVID, you've got a bad virus. And he said it's bothering your gland. He said it's infected, but it will fix itself in time. So Michael Daly knocked out all the other symptoms, but this gland is still bothering me. So I was just wondering, will it be continuing to take it? Will it fix it? That's all I wanted to know.
Well, it is hard to predict because we don't have too many examples of that experience in this area. And therefore I said that, in a scenario like that, you have to take 3 to 6 months before you see, like some of your colleagues were recommending tissue modification. And in this case, but if it doesn't go away, then see the doctor. So you may have some other.
Go back again, yeah.
Okay, all right then. Thank you very much. I appreciate it.
Thank you for your question, Linda.
Why do I go to sleep? Why do I go to sleep and everybody else stays awake?
I think
no, you're not the only one. A lot of people go to sleep right away with it.
The sleep problem could be also because of the residual problem that you have a survivor of COVID.
No, it's always been that way.
Actually,
but
this
when I-
micro daily can relaxes you, so you go to sleep further. So
Okay. All right, thank you.
But just to add to that, Linda, I know for me personally, early on when I was having sleep trouble, that's one of the things that that Jeff recommended I do. He said, just take the 3 capsules just before you put your head on the pillow. He said, watch what happens. I couldn't believe it. It put me in a coma. So that's one of the benefits of micro daily for some people. So you're not alone.
With me. Thank you so much. When everybody else said so much energy, when I take Michael Daily, I'm out. I said, what? No, I don't have all this energy that they're talking about.
You're not alone. So don't worry about that. You're in good company with that one. All right. So that's really all the time that we have. I apologize, Jackie. You can send me an email and I'll address your question at some other point.
Question you can send to Jonathan, and then Jonathan can send it to me.
Yes, I'll make sure. So please, Jackie, send me an email with any other questions or comment that you have. But for everyone, Dr. Prasad, we can't thank you enough for joining us. We certainly appreciate your taking the time to always come out and speak with us whenever we need you. But for everyone to just keep this in mind, this discussion is for educational purposes only. This is not to be intended to be a substitute for a visit to your primary healthcare physician. Make sure you seek the competent medical advice of professionals that you trust. But just to make this real clear, everyone, how do you feel? How do if you guys can unmute yourselves now and express your thanks to Dr. Prasad.
Yes,
Thank
thank
you,
you.
Dr.
Prasad.
Right thing at the
Thank you
right
so
time.
much,
Thank you,
Dr.
Dr.
Prasad.
Prasad.
Thank you, Jonathan. Thank you, Dr. Prasad.
Welcome. Good to
We
see
really
you.
appreciate you
We
very
really
much.
do.
Very much.
Thank you for coming on, Dr. Prasad.
Yes,
Micro
thank
daily
you.
is what cured me. I just want to say thank you.
I know
So
that's right.
informative.
Thank you. I really
Okay,
enjoyed it.
everybody. Listen, everybody,
Okay.
bring a friend next week. The recording will be available tonight. If you want to share this with someone, the recording will be available tonight on Jonathan Jones, youtube.com/Jonathan Jones. You'll be able to get the recording and share this with anyone that you like to tomorrow. Otherwise, we'll see you guys all next week, everybody.
All
Have a
right,
good
thank
night.
you. Bye
Bye.
now.
Thank
Bye.
you. Thank you.
Bye, Jonathan.
Stay well,
Bye.
everyone.
All right,
Stay
everybody.
well.
Bye, everyone.
Thank you,
Thank you
Dr.
so
Prasad.
much. Thank you.